The World Health Organization, you know, we did a lot of research into the World Health Organization and discovered so many things.
Yes.
So since its inception in 1948, it wasn't actually something that was directed towards health. Their primary goal was actually development.
Good morning, my people. Again, we are here at Hekima Hub, and we're going to build conversations from the last episode, and we have to talk about things that no one is ready to talk about. We are going to delve deep into the COVID shots after effects, the adverse effects, which are conversations many countries are not having. But here at Hekima Hub, I'm today joined by Dr. Eda. Dr. Eda is she's been in this field. She understands what has been going on. We are going to be having conversations about adverse effects, what went wrong, what didn't go well. And before I even go deeper and hand over, this conversation to Dr. Eda, let me just do a bit of an introduction of who Dr. Eda is. She's Dr. Eda Beuttah, and she's the founder and the executive director of Wastahili Family Wellness Center in Nairobi. Dr. Eda is she's a medical doctor. She's a retired surgeon, ophthalmologist, psychological counselor, and wellness coach through life and human life cycle with experimental knowledge in trauma recovery. She's also a mental health champion and a trauma survivor. So you can see she's exposed to the things that affect people mentally, even physically. Karibu sana Dr. Eda here at Hekima Hub. Let's have this conversation.
Thank you very much, Mary, for that introduction.
Thank you.
Appreciate it.
Karibu sana. And in our last, the introduction I did about the COVID jabs, that's what we call them nowadays. Yeah. There's a lot that was not making sense, from 2019, we are in 2025. And I feel this is the time we are feeling like the after effects of these shots. And a lot of these conversations today maybe are going to go more so into the adverse effects of the people that took the jabs, and even looking at the scientific papers that have been published until today, highlighting what was actually not right.
Yes.
And we are also going to look into testimonials, Let's just delve in, just feel free, because personally I'm going to learn a lot from you, and definitely you're going to learn a lot from me too, as we build these conversations, and basically it's just helping our society.
Yes.
Yeah.
Well, let me start by saying these past 5 years have been very traumatizing, starting with the onset of the COVID pandemic. We call it a pandemic.
It's a pandemic now.
Yeah, the lockdowns, the fear, the way people were terrorized. And that's not how we practice medicine. Medicine is actually, you're supposed to give hope to people. So the whole scenario was very traumatizing, including for doctors, because we have what we call a Hippocratic oath that we took. And a Hippocratic oath, there are many things that we said, but let me talk about 4 of the main ones. Medicine cannot be practiced in a vacuum. You must practice medical ethics. And the first precept of medical ethics is to do no harm. And the second one is to always do good. So beneficence to all the patients. The third one is informed consent. And informed consent is autonomy of the patient. So we must respect the preferences of the patient, and we must always give an informed consent for whatever treatment that we're going to give. And the fourth one is justice for all. You must you must treat everybody fairly, and you must expose when a malpractice is is happening. So none of those were followed. Harm was done.
Yeah.
We didn't do good to the patients. There was no informed consent, and definitely we were not treated fairly. As we speak now, people are really suffering, and others are 6 feet under. They have unfortunately passed on. So this is actually horrific. I don't even know what words to describe how horrific it is.
It was horrible.
Yes.
When you look at situations whereby you find countries like Senegal that developed the medicine, but the WHO, like pushed down that.
Yes.
Countries like Uganda that were using particular doses of hydroxychloroquine to treat, but that was suppressed. You look at countries like Madagascar, whereby they literally the scientists in that country manufactured medicine. It was a crisis, and every community was trying to survive.
Yes.
And when I look at that, I'm finding a lot of a controlled narrative. And when there was the treatment that was rolled out and acceptable by the WHO, what they pushed in hospitals was ventilators, that is what was sort of accepted. But as we speak today, it's been proven that the ventilator way of treating was actually putting more pressure on the lungs. Out of that particular treatment, more people actually died. I have a lot of questions, Dr. Eda. Why was this narrative so controlled? Why was the treatment so controlled? We looked like we were being led through a particular path, because then, you cannot have one singular way of treating a disease worldwide. Even when you look at climate, some places are hot, some places are cold, bacteria survive differently in different places, viruses. So what was this about a controlled way of treating COVID-19?
You see, like what you're saying, the World Health Organization, we did a lot of research into the World Health Organization and discovered so many things.
Yes.
So since its inception in 1948, it wasn't actually something that was directed towards health. Their primary goal was actually depopulation.
Depopulation.
And that is even in their documents, yeah. It wasn't about public health. So whenever they wanted to do something, they always have to create a narrative. So there's a sequence. They actually plan what they're going to do. Then they find funding for what they're going to do. Then they create a narrative. So the whole thing was geared to something called the Hegelian dialectic. You can look that up. That is, create a problem, then get a reaction. Then when you've gotten there, it's all psychological warfare. Then when you've gotten the reaction, you come in as the savior with the solution that you yourself had wanted from the very beginning.
So sad.
Yes, so since they wanted to use this, it's actually a bioterrorist weapon to depopulate. Yeah. They actually planned it all. As you said in your previous video, that there was Event 201. Yeah. But all these things had been, it had been orchestrated towards the vaccine, towards the jab. And the jab had nothing to do with health, but it's not treatment, because medicine is actually summarized as the diagnosis, the treatment and prevention of disease.
Dr. Eda, when there's something you just mentioned,
yes,
that it was, you create a problem and look like you want to sort the problem.
Get a reaction
from the
problem.
Get a reaction from the problem.
It's all psychological warfare.
Right now, we have documentation. Initially, they told us that this virus was a Wuhan virus, but we have documentation. That the American government literally funded, in the Obama administration, they funded the Wuhan labs. But as years go by, now the Chinese government have come up and they've said, Americans, you need to speak the truth. Yeah. This was your virus.
Yes.
This was your project. We were just used.
Yes.
And when you look at all these things, and you're a doctor, I'm sure you'll tell us these things better. Anything that happens naturally is not patented, like a flu that just comes in nature, it's not patented. But when you have viruses that have been patented, they are owned by a particular person, that raises a lot of questions.
Red flag, yeah.
Yeah, it raises a lot of questions.
Yeah.
My feeling is that the entire globe, the entire humanity was set up. You know, we were literally set up to walk towards the jab.
Yes.
Go ahead. Yeah.
What they wanted to get was the emergency use authorization.
Emergency use authorization.
Yes. And you cannot get emergency use authorization when there is an alternative treatment. So they couldn't patent the drugs that, in fact, we were using hydrochloroquine, we were using ivermectin, erythromycin, vitamin D, vitamin C. We were advising people to get vitamin D through exposure to sunlight and living a healthy lifestyle and having a balanced diet. Did you ever hear the World Health Organization giving any advice about healthy lifestyle?
Not at all.
Yes, so it was all about terrorizing people into that and then suppressing all information because they couldn't patent hydroxychloroquine. They couldn't patent ivermectin. These are drugs which were repurposed for that. And they were found by people like Dr. Zelenko to be working. And so even the late Dr. Zelenko found a protocol and he publicized it, and he was humiliated. Doctors were being humiliated. They were being deregistered all over the place because they didn't want the news to get out that people were getting well. Yeah. It's a fact that people were getting well from these protocols. Yeah. But because they wanted the emergency use authorization. And also, you know that when you're terrified and you're stressed, your immune system also goes down. So you're also more susceptible to disease. Yeah. So yes, so it the presence of ivermectin and hydroxychloroquine was very inconvenient to them. And like you said something about the gain of function research. Yeah. The gain of function research in Wuhan was, we even have the letter that was signed by Fauci himself. Wow. From his organization. And this is terrible to have gain of function research, which means that you try to make a virus or a virus so to be very virulent. Yeah. How can I say it? That it can infect human beings in such a bad way.
Make it like more lethal.
Make it as lethal as possible. Yeah. That is what gain of function research is all about. Yeah. So this had nothing to do with medicine.
It had nothing to do with health.
No, I've just told you medicine is the diagnosis, prevention, and treatment of disease. So actually to create disease so that you can benefit and get funding for the so-called jab. Yeah. It was diabolical from the start.
Even picking up from that conversation, Dr. Eda, every person that was jabbed still got infected of the COVID-19. Yes. So it didn't even make sense why we were so pushed to this jab, but yet most of the people that actually took it were infected with COVID-19 over and over and over. Even after the first shot, the second shot, the booster. Yeah. So the explanation that, of course, you'll have word in the street that, the symptoms are not as severe, as the people that are not jabbed, does not still make sense, because if you ask me, you're opening my eyes into the real purpose of the WHO. I think WHO is a terrorist organization. Yes, it is. That is an organization that every African country needs to deregister from, because they have not proven to bring the solutions to mankind that we expect. Because if you ask me until today, I know a few countries here and there have managed to go to court, maybe on individual levels, civil lawsuits, and sued these manufacturing companies. But we need to look at the monster in the house, the WHO, that was sat back, perpetrated, pushed all this. But the intention really was not to save humanity. But no one is holding them to accountability. That is the saddest thing. No one talks about the deaths caused by this jab. Yes. No one has had, maybe if you tell me, no one has talked about, like seriously, about the adverse side effects that so many people are suffering from. No one is talking about the increase of blood clots that are killing people. You know, even in Kenyan hospitals, there are clots all over, a clot in the brain, a clot in the leg, and if those clots are not arrested really early, these people are dying, you know. No one is talking about, I find the adverse effects so severe when you think about we are suffering through all this because our intention was to reduce the severity of this virus. It doesn't make sense. And we are not having those conversations.
Yeah, in fact, when you talk about these things, you become ostracized. But then I have been talking about it in my community, and people have been admitting that there's a problem. There's a very serious problem because we're burying people. Yeah. It's a fact that we're burying people. Yeah. And there's something called sudden adult death syndrome. And there's even a documentary that was made called Died Suddenly, because you'd have all these people dying suddenly. And we've never had a pandemic of people dying like this suddenly. So when you talk about the adverse effects, let's talk about how the jab affects the mRNA. Okay. Yeah. The mRNA from the jab actually goes into the bloodstream, and it makes the body produce something called a spike protein. Yep. It enters into the cell, and it makes the cell produce a spike protein, which is identical to actually causes the same symptoms as the virus itself. And when you have this spike protein, it causes different effects in the body. And the main effect, one of the major effects that it causes, the lining of the blood vessels. The lining of the blood vessels is called endothelium, and it's not supposed to be disturbed. So it causes a disturbance in the endothelial lining of the blood vessels. And once you do that, the body immediately comes to repair that in the blood vessel. It's supposed to be as smooth as this table. So you will get a clotting mechanism. You get the thrombocytes, which are platelets, which rush to the site to repair it. And then you get something called fibrin. So one of the first things they noticed in the postmortems were these very long blood clots in the postmortems. Very rubbery blood clots. So obviously, depending on where the blood clot is or where the inflammation is, then you'll get the symptom. Yeah. So if you have a blood clot and it moves to the lungs, you will obviously stop breathing because of the interface in the alveoli, in the cells in the lungs. You're supposed to have a smooth exchange, so it affects that. So if you have a clot in the brain, you'll get something called an ischemic attack, and that will present as a stroke. Yeah, but also so every single system in the body is being affected, and so in the lungs, when you they were treating it with they thought it was something like pneumonia because people were having breathing difficulties and coughing and all that, and so they were trying to help the person get their lung function back with the ventilators. But you see, it wasn't like a pneumonia at all. It was actually a vascular problem. And so they realized there's something very different about this, because your oxygen levels are going down to dangerous level. When we try to help you, you actually pass on. So the secretions in the lungs were actually being pushed down by the ventilator. So the person basically like drowns. Yeah. And then though all the studies were coming out and doctors were complaining that people are dying very soon after ventilation. Yeah. It was actually very horrific because since the purpose in the beginning was that people should pass on anyway. Yes, and they were incentivized to put people on ventilators. And if you look at the way the World Health Organization, 1947, they actually started out by having a document giving themselves immunity against all prosecution. All prosecutions. That's crazy. So if somebody starts out with an organization and says we want immunity for every single type of prosecution.
They're out for bad things.
Is that something? Is that an organization that wants to do good things for humanity?
Not at all.
Not at all.
Yeah.
So even in Kenya, the lawyers actually said that there's no immunity for the World Health Organization. You know that was passed. And so the World Health Organization actually, you know, they kind of withdrew.
Yeah.
Why do you want immunity from all prosecution? It's because you know what you're doing.
Your intentions are
so all the intentions are all coming out. And so people have, some of the adverse effects of the jab have been, it was very, because I'm a fertility education coach.
Yeah.
Women immediately had abnormalities in their ovulation cycles.
Yes.
So, and they would start bleeding. Actually, a friend of mine who passed away, she just started bleeding. She was 7 years in remission from cancer. Yeah. Her cancer came back. So we're having what we call turbo cancers that, you know, you're diagnosed in January and before June you've already left. Yeah. So it was very, very traumatizing for us. You could see some women were getting what we call amenorrhea, misperiods. Women were having miscarriages, stillbirths, and it was really, really horrific. Infertility right? Like
is
now,
really high right
we're
now.
dealing with a lot of women who are actually infertile. Yeah. And the same World Health Organization in 2015 and 2014 was found, do you remember that tetanus vaccine?
Yes, that was rolled out in Kenya.
Yes, for all women of reproductive age.
Yes.
So actually what they have done, and all this research, there's even evidence that there was a meeting from 1992, but actually from the 1970s, they have been working on this, to how to sterilize women by pretending to give them a vaccine.
Yeah.
So 1992, there was a meeting between the World Health Organization, women's groups, UNDP, World Bank, all this, and they came up with what they call a vaccine that is attached to the fertility, human chorionic gonadotropin, HCG, which is very necessary for a woman to carry a pregnancy. And so they tied it to the tetanus, the anti-tetanus part of the jab. Yeah. And so the woman, when she's making antibodies to the tetanus, she's also making antibodies towards the HCG. So every time she gets pregnant without her knowledge, you see, I talked about informed consent. Yeah. She actually loses the pregnancy.
And this is science paper. This
diabolical. Is written. Yes. In fact, the Kenya Catholic Doctors Association exposed them in 2017 and wrote a document about it. And they tried to suppress it, and it didn't work because all the evidence was there. And there is a lady, she's called Pastor Antonina Mutinda. She's actually gone public, so I'm able to talk about this. If you Google, you'll be able to go to a documentary called Infertility, a Diabolical Agenda. So the World Health Organization is not our friend. Can you imagine?
No, it's not.
How diabolical is that?
No, it's not.
The women who are sterilized against their will.
Yeah, with no knowledge.
Without knowledge. This is not an organization we should trust. And are you aware that the United States of America has actually withdrawn from the World Health Organization and the United Nations SDGs?
Yes.
They've actually withdrawn from everything. Yeah. So I think Africa, we just need to have our own sovereignty.
No, we need to have our own sovereignty. We need to take control of our health because we are trusting a foreign body that doesn't have the interest of the African people to run. And it's been proven time and again, they are actually not working for our benefit. You know, Dr. Eda, I keep asking myself, you know, for the people that took the jab, there's a barcode.
Yes.
And you are to get it on the MOH website. And I kept asking myself, if they were this keen on collecting data, like you got in the jab, you didn't get the jab, why didn't they build a website of a reaction, you know, or a way of people giving information if there's going to be a reaction? So this is a deliberate way of, you know, like blocking people, because when you talk about the adverse effects, I have friends myself.
Yes.
I have female friends who their menstruation was 2 weeks of bleeding,
yes,
until they get anemic.
Precisely, yeah.
Literally, they can't even go to the office because it is bleeding until they have to do supplements for blood.
Yeah.
I have friends that have gone into menopause at 35.
Yes.
And when you look back, you're trying to scan, what's wrong with me? What did I do? That's the only thing I did. I took a jab.
Yes.
We have people that have, and this is such a major problem in the male population, the men.
Yeah.
A lot of men are suffering from back problems. I have a lot of those people. Back problems, and they're calling it sciatic nerves, you know, where the discs are collapsing on each other and pushing out a ligament that is pushing against the nerve, you know, the nerve endings. And that pain goes all the way to the legs.
Yeah.
You can't walk, you can't sit, you know, those excruciating pains. And sometimes I think they rolled out this jab, even as an experiment of how serious these adverse effects were going to be. Because I've taken a patient to hospital myself for in a chiropractor's clinic, and at the bench were all men, and we're all having back problems. And they say, you know, after I took this jab, you know, after I took this jab. And we have these problems even in the women. We have thrombosis, as you said. We have nerve problems, you know, serious nerve problems. This terrible cancer, you know. And you know what really scares me? We have no system of collecting that data. How is that data going to be collected? Because this is data that will inform decisions in the future. Is the government collecting this data? Are there governments in Africa that are doing this?
Yes.
Yeah, that's really, for me, is the big question, because now it's an aftermath.
Yeah.
Yeah.
Well, actually, we've been using the South African Vaccine Adverse Events Reporting System. We call it VAERS. And it's only this morning that I discovered that there has been a reporting system in Kenya. But why have they been quiet about it?
No one talks about it.
Somebody had to really, really search for it. They've never advertised it. So I would prefer that people use the South African reporting system. We will, because when you do a drop down, you'll be able to find your country. And they have been very sincere about it. I've been sharing it with the people who have been having adverse effects. And many of them are not really interested. They're so disappointed with their condition. And when they realize they had been tricked into taking the job, they're just so hurt. Like there's a lady even who was supposed to come today, but she's so terrified about being victimized. People are very traumatized. Can you imagine? Even I'm still mourning the deaths of my loved ones. And there are 2 doctors, one of them who got myocarditis, and she had a pacemaker, she passed on. Another one also got into terrible cancer. You know, I really told them, please don't. But for some strange reason, the propaganda was so heavy. Yeah, you know, you're told that life will not go back to normal until you do this, you know.
Don't kill your grandma.
Yes, children being terrorized into not visiting their grandparents. So actually every system in the body that you think of is being affected. So we have the central nervous system, and which consists of the brain and the spinal cord. Then you have the peripheral nervous system. So then you have the cardiovascular system. You have the respiratory system, you have the reproductive system, and all the systems are interconnected. If one is affected, the rest will be connected. Apparently, the spike protein was found to enter the gonads, the ovaries, and the testes 72 hours after the jab. And so there was this doctor called the late Dr. Eda Beuttah in Germany. He actually came out of retirement. He's a pathologist. And because he was really wondering why all these people were dying. And the doctors were saying, the pathologists were saying that they died of natural causes, and yet the relatives were not happy. So the relatives said, no, these people died after the jab. So they got to him for a second opinion. So he actually came out of retirement And he got a whole bunch of pathologists.
Yes.
And he said, let's study this together.
Let's study this whole
thing. And they were enthusiastic in the beginning.
Yeah.
And then when he started finding strange things, especially like the inflammation that's caused by the spike protein, they all backed out. So he found himself totally alone, and he did 75 postmortems before he passed on. And he said they were very strange, like autoimmune diseases, because the autoimmune system is also a system. Mm. And, I'm a member of the International Association for a Disease-Free World. And doctors have really been dying mysteriously. Yeah. Yeah. The founder is the late Dr. Eda Beuttah.
Okay.
And they discovered all these things that we're talking about, the strange clots and all that. And they discovered that with each shot, actually your immunity goes down. It kills the CD4 cells. So that is why you're finding the increased infection. It doesn't do anything about it doesn't raise your immunity at all. Yeah, the jab actually, for each and every booster dose that you have, you actually reduce your immunity by half. So the first one, you reduce your immunity by 50%. Yes. The next jab, you're now down to 25%. Yes. From 100 to 50 to 25 to 12.5. And this was the intention from the beginning. So that is why not only are we in mourning for our loved ones, but we're experiencing anticipatory grief for those ones who went ahead and took the jab and are not sick yet. So you see the trauma that we're going through, because you know that, and people are actually realizing that there's a very serious problem. Yeah. So every single system is affected by the spike protein. You actually have become a manufacturer of your own poison that is destroying your body cells. Yes. So if it goes to the spinal cord, that's where the symptoms will be, the spinal column. And, every single system has been affected, and that's how people are presenting.
And when you look at even the science papers that have been even studied and they've been published, and you look at even some governments that have got the balls and have gone forth and asked the hard questions. I watched the EU Parliament hearing where they had Pfizer come, and they were supposed to come and file documents on human trials on the vaccine, and they were at pains explaining, because normally there is a time span for a vaccine to even work or even to be proven. There's a stage. I'm sure you're a doctor, you'll be able to tell us this. There's a human trials. There's so many stages. I'm sure there's no vaccine that is rolled out to humanity by 2 years. You can't have a vaccine that is rolled out to the people in 2 years. And Pfizer has gone to pains just trying to explain this, but it's been in Europe. It's been proven in the EU court that what they call the jabs were not ready to be rolled out to humanity, and they have to take responsibility on the damage that they've caused on the human health. Yes. When you go to the US, I know the Trump administration has withdrawn the jab, the COVID jab, as a mandatory vax. It's now optional, but still there's more to be done. They're doing the superficial, like the, juju. They're not doing the real thing. Yeah. The real thing is who takes responsibility of these errors, of these mistakes. Yeah. Yes, they withdraw it on the requirements, but what happens to the people that took them? What happened to the information? The wrong information they gave to people. Yes. I know Moderna. I know Pfizer has been sued and paid damages to some patients. I know Pfizer too, and we have hearings that have happened in different countries. That have come to the conclusion that the damages caused by the so-called jab, which is actually not a jab, were way more.
It's not a vaccine. It's a jab, right? It's definitely not.
It's a jab, but not a vaccine. Yes, it's a jab and not a vaccine. Yeah. And when you look at these things, I'm really perturbed by the gaslighting. Like no one wants to talk about the mistakes. No one wants to talk about the errors, the serious damages they've caused on humanity. Yeah. And even better, I do not know unless you have the knowledge to that. Do we have an African country? I know in Africa, lucky or I don't know if it's not lucky, the masses didn't really take it as much.
Not at all.
Not at all, because in Kenya, how many millions were we in Kenya? I know we were not 10 million, not even 10 million Kenyans took it.
Very few. And especially in the slum areas.
Yes.
And the lower socioeconomic status people,
yes,
who live many in a room, can't afford masks, but they get plenty of sunlight.
I know, yeah.
They drink plenty of water, they have plenty of vegetables. None of them got sick.
None of them got sick.
And they were serving actually the middle class areas, because you know we have a lot of low income areas next to middle class areas. And the middle class and the middle and upper class areas, people were really dying because our diet is not really healthy. We don't get exposed to sunlight, you know, especially if you're an office worker. So the contrast was huge. I mean, they would come from their houses to work in these homes. The people in the middle class homes were very sick and dying. And they were going back and saying, for us, we're fine and we're not having the jab.
That's very interesting.
Yeah, so, and the one masking themselves, you see, there was this narrative completely, not proven, of how we must stay meters apart. In fact, all that was to terrorize people, because you know what happened? Somebody actually talked about mass formation psychosis. People are actually psychologically unwell. They're in a state of denial. They were terrorized into a mental state whereby all they wanted to do was get out of that situation. Yeah. And you do that by isolating people and terrorizing people. So making making people, not, like you said, not visit their grandparents. Yeah. People were terrorized into not socializing. Yeah. In fact, studies have been shown that the children of that period were very badly affected, because children, when they're growing up, they do need that, the visual, your facial expression is very much part of their development, their brain development. And then here's your mom and dad in a mask. So you just see the eyes, you don't know, they're not getting all those other cues that children need. So, and even the what do you call it, the PCR test was found to be fraudulent. In the late owner, people are becoming late. Yeah. He came out very loudly. What's his name? I'll try and remember his name.
The guy who invented
who invented the PCR test. He said, this is just it's just a signature. If it's positive, if the test is positive, it's just actually shows that there was a virus here. And a coronavirus or an influenza virus, it's just a signature that it was there. Yeah. But it cannot be used to diagnose active infection. Wow. So actually what they did was make billions from the PCR test. And even as you're talking about Pfizer, they made so many billions that they don't mind paying these millions to people. So they took that risk, and they have been, but they've actually been behaving like that. Did you know that Pfizer had actually made a patent in 1990 of a so-called vaccine, of the spike protein itself? Wow. And all the studies have shown that there's no vaccine that can work against a coronavirus, because the coronavirus itself is something that keeps mutating and changing. Yeah. Do you know when they isolated this in America? 1965.
1965.
So this is a diabolical agenda that's been happening for as long as my age.
This is
basically
crazy.
So 1965, they actually they isolated a coronavirus, which is in the family of the flu, so that they could make it virulent towards human beings, so that they could come up with a jab and make billions
out of it.
For as long as that. In fact, it was exported in 1966. America exchanged the information with the UK, and they actually experimented on human beings in 1967. Wow. So this is a very diabolical agenda. We're here thinking that the World Health Organization loves us.
No, they don't.
No. So it's just a criminal cabal in collusion with criminal cabals.
And you know what is so interesting when you look at you know, most of these countries that were not really fitting into the narrative. And you look at Tanzania, Magufuli, you look at the Madagascar president, you look at, I can't remember if it's the Congo president.
Yes.
You know, there's something that is not adding up, you know, about how these presidents just, you know, disappeared out of this place. And it was, you know, when you mention and when you say you cannot develop a vaccine on this particular virus because it mutates.
It keeps mutating.
And these are science papers out there that shows that, okay, that's why they were talking about, you know, second shot, that shot, booster, because they've tricked the human mind that the more you take, you're countering the mutating virus. And it's also proven the more exposed the virus is, the weaker it becomes.
Oh, yes.
The weaker it, because it doesn't even affect the people. You know, it's just in the air. That's why we survive with a lot of viruses, but they don't affect us. But come to think of this, Dr. Eda, the way they prescribed modes of treatment and how they had this whole narrative. We have to social distance. When these patients are taken to hospital, they're kept in isolations, okay? And the mental torture of having government announcements every single day of numbers of these people this is infected, these ones have died. What do you have to say about the psychological torture, which to me was actually the biggest disease, not even the virus itself?
Even for us doctors, you know, the relationship between a patient and a doctor is sacred. My relationship with you is supposed to be confidential. But you know what happened? In between you and me was the World Health Organization, the United Nations, and the Ministry of Health.
In between.
Doctors were being told what to do.
What to do,
And they were prescribing something for which they didn't know the contents of. So I am not allowed, that's why we have so many months of pharmacology. I can never write a prescription unless I know what the ingredients are. But doctors were left, right, and center, parroting the narrative of safe and effective. And they had no clue, clueless. No clue. It was poison. It's a poison death shot, like the late Dr. Zelenko always used to say, don't take the poison death shot. So what happened was that sacred relationship was violated. And the doctors were being, I don't know whether it's coerced, because I'm so glad that I must tell you, I'm so glad to be out of the system. Because they had their jobs on the line, and they seemed to be so terrified. In fact, I actually got thrown out of doctors' WhatsApp groups just by telling them the truth. Pfizer lied and people died. You know, that was the mantra that was going around among the people who knew what was going on. So the terror, like you said, 3 o'clock every afternoon. Wahome Mutahi, what's his name?
Mutahi Kagwe.
Mutahi Kagwe. Was on the news to tell us, with this Mwangangi, Dr. Mwangangi lady, to tell us how many people have died. That's not how you practice medicine. Terrorizing people. The whole narrative was to terrorize people so that by the time you are now bringing the solution to how we will get back to normal, they will jump at it. And even the Kenya Catholic Doctors Association, the Kenya Christian Professional Forum, we actually said, do you know that we lost 10,000 people in car accidents? We compared the number of people who had died in car accidents to the number of people who are dying from actually dying from the so-called virus. And it wasn't adding up, because why aren't we announcing at 3 o'clock every day about the number of car accidents? And why aren't people stopping not going by road anymore? So that was one of the questions we had. You're not supposed. So that is actually why somebody came up with the idea that we have what we call a mass formation psychosis. Everybody was actually mentally ill. The people who believed, because we were listening to Dr. Rashid Buttar, who was giving us hope, who was always giving us hope and saying, this is the narrative. Don't listen to it. Your biggest enemy is fear. So you can imagine you're staying in your flat, you're isolated from people, you're not visiting people, you're not feeling well, you know. And they were just so terrified into it that by the time now, like I said, the narrative is to create a problem, get a reaction, and then bring the solution. Up to today, people haven't recovered from that mental illness.
Yeah, yeah.
When you talk to some, they just glaze over. When you try and talk to them, you see their eyes just glazing over. Others have actually come out of that psychosis, but many people are not actually mentally well. You can even tell it from, it's something called post-traumatic stress disorder.
Yeah.
So we were so traumatized, and then you have post-traumatic stress disorder, which is a one-time event, but you have something called complex post-traumatic stress disorder, when you repeatedly traumatize somebody. In an adult, it will come out as burnout. So we have many burnt out adults who are just going through life, you know, what do you call it, in autopilot. Because they still haven't recovered. So what happens when you get somebody in that mass formation psychosis, and then you present a solution? Everybody who is against that solution, those are the doctors who are speaking the truth, like the Kenya Catholic Doctors Association, Dr. Wahome Ngare, and Dr. Stephen Karanja, the late Dr. Stephen Karanja. You become the enemy. Even I became the enemy. Your relatives tell you, just shut up, you know. You lose friends, your neighbors just treat you like a psychopath.
I was also in that space because all through I spoke against, like I really did a lot of speaking even on social media. I was a big social media influencer, but you become the enemy, you become the ostracized. And people think, what's wrong with her? Is she okay? You know, and when I look, Dr. Eda, on the conspiracy to silence,
conspiracy of silence. That is the word, exactly.
I look at the WHO. I look at governments. I look at hospitals. I look at administrations. You look even into the education system, where they even came to schools. You know, in my village, chiefs were walking, you know, like in every homestead, and making sure the old grannies and grandpas were jabbed. You know, and if you didn't, it was like a war. Literally, that was a war. And I'm seated here, and I'm sure you and even our listeners, you know how even people came forth and said, we lost our relative in the hospital, but they didn't die of the coronavirus. Why have you put on the certificate that they actually died of the coronavirus? That's that they had diabetes or they had blood pressure, but every single death in hospitals was branded a coronavirus death until people were making noise. I remember, is it Wetangula's mother who died? And they came forth and they said, no, our mother didn't die of the coronavirus, but on the certificates. So then you realize this was a web of conspiracy, of silence, of gaslighting. And I'm sure deep in their hearts, they knew this is not right, but they had to walk the walk. You know, they had to do what they were being forced to do. And for me, these are the conversations we need to have as a society. Because if we do not have these conversations, we are going to find ourselves in such a situation. It doesn't matter even 100 years to come, but we need to be able to talk about this, you know, like when they say, when they say Africans should not talk about the slave trade, the slave atrocities, you know, the Mau Mau, but then every other community is allowed to talk about their issues. Out of talking, we get healing. Out of talking, we are able to separate the truths from the lies. And when I look at, I know, of course, a lot of these organizations have protected themselves in terms of legal redress, you know, like the WHO is protected, you know, but it's not even about compensation. It's about having conversations and knowing where the lies were, where the truths were, where the conmanship was, what the truth was. And I would really encourage Africans. Thank God, I know you talked about diets. You know, many Africans didn't die. then.
Yes.
Many Africans did
Healthy
that.
diet, yeah.
Healthy diets.
Yes.
So what you eat really comes in so strongly.
Yes.
Your food.
We are what we eat. Yes.
Your choice of food is so important.
Yes.
As much as Melinda Gates said that she even shipped in body bags into Kenya, you know, and said there were going to be bodies all over the place, you know, bodies all over the place. She dreamt.
Yes.
But it didn't happen. It didn't.
Much to her disappointment.
To her disappointment,
yes.
it didn't happen. So as much as we were not really heavily affected then, we still need to have these conversations, even for the 10 million that took it.
Yes.
Yeah.
In fact, what you've said is so true. Do you know that it was proved that people were being incentivized to write that the death was caused? Yes.
Oh,
even in America, they found that even if you come in with a fracture, and you died of a road accident, they were actually they were incentivized to write corona on the death certificate. There was actually money, an exchange of money either between.
Attached to that, yes.
Oh yes. That is how diabolical this whole thing was, because they needed the numbers and they weren't getting the numbers.
Yes, they're not getting the numbers.
Because you even saw the videos of medical personnel dancing in the hospitals.
Because there were no patients.
Yeah, there were no patients. But they needed to cook up those numbers. That's how diabolical it was.
This is
and so because they needed to say, yeah, these are the number of people who are dying. And so I actually prevented my mother from getting it under a lot of pressure.
Yeah.
She would have actually, and every day she thanks me. She says, thank you for preventing me from being jabbed.
Yeah.
Because that was what was going to happen to her.
Yeah.
And so actually when I meet somebody who's not jabbed, for you to be able to withstand all that peer pressure and all that ostracization, I know that you're a different mindset. True. And even we're advising people, because this thing, the spike protein is actually sexually transmitted. So if you didn't get the jab and your husband was jabbed, you will actually get all the effects. Yes, you will get all the effects of somebody who was jabbed. Wow. So we're advising young people or people who want to get married to please ask the vaccine status. You know how you ask HIV status and STD status? You have to ask a vaccine status because you will get it's sexually transmitted.
It's sexually transmitted.
Yeah, all the people whose spouses were jabbed and they became intimate, they started showing symptoms later. Wow. Yeah.
Wow. In conclusion, you know, I would want us to, I'm hoping we're going to be able to build a platform whereby we bring more people that can talk about the effects. Yes. You know, my mother taught me one thing in Kimeru that says it doesn't matter if you're poor or if you're downtrodden, you should always have a voice. Yes. You should always have a voice because that's what God gave you. Yeah. So out of these videos, I want people to watch, I want people to come forth and talk about issues that they are going through. Yes. The low sperm counts, the infertilities, the back problems, the migraines. Oh, yeah. You know, serious.
You know that migraine is a vascular disease.
It's a vascular disease. Yeah. I would want people to come forth. Let's have these conversations. Let's build, because there's no one is going to do this for us, Dr. Eda. We have to do this for ourselves or our societies. Yes. We have to do what we call self-preservation as a society. Because the most trusted institutions, you know, changed us for the highest bidder. Yes. The governments that were supposed to protect us were part of the system. Yeah. You know, the doctors where we ran to the hospitals were part of the conspiracy of silence and of blackmail. Yes. So we have to get our voices, we have to speak, and we have to audit. It doesn't matter how many years this takes. We must be able to audit the atrocities on the people. And I'm encouraging people to come forth. I want us to have more of these conversations together. Let's talk about the HPVs. Let's talk about the tetanus. Let's delve deeper. Let's have these conversations, you know. Yes,
HPV, and also, you know, the World Health Organization is pushing for a malaria jab. Yes. I don't think we can trust any jab that comes from the WHO anymore, because there is actually treatment for malaria. Yeah. There's a paper that was done, Artemisia is actually working. Artemisia infusion is actually working. Do you know that the person who was behind that study, the study was retracted? He was forced to retract it, and now his life is in danger.
Oh my.
Yes, so I'm actually in that space of naturopathic. I've completely left allopathic medicine because I also discovered in my research that naturopathic medicine was actually the original medicine.
That was the original medicine.
Before
Yeah.
the Rockefeller family came and invaded and took over the medical system, and they're in charge of all our textbooks. And so we have so many hours on pharmacology without, pharmacology, pharmacokinetics, without a single class on trauma, psychological trauma, which is so much a part of our health and our health outcomes. Not a single class on nutrition, except for the occasional mention on vitamin deficiencies. That is all criminal because our textbooks and our curriculum was all, it's all being sponsored by, from the time of the Rockefeller invasion, and they actually killed so many naturopathic doctors. So I do mentor.
I think this is a conversation. We're going to have another podcast. You're going to have a conversation. I'm big on herbs, and I'm big on herbs. Treating in the kitchen, treating from what you cook, and I think this is another. It's an indicator that is a conversation we need to have.
I'm a beneficiary.
Of herbs. Of herbs. This is awesome.
Herbal supplements, right? Because people tend to equate herbal medicine with witchcraft when they want to put you down. They're not. I would say that the World Health Organization is the one that is practicing witchcraft. Yes. For example, the Director General of Health, we're in the process of writing a petition. He's the one who was supposed to advise the president about this. And right now he's pushing for sexual and reproductive health and rights, including abortion, which is the deliberate killing of the preborn person, and contraceptives for children. That's all witchcraft. That's not medicine.
It is.
Yeah.
It is. Dr. Eda, after all this an hour conversation, what's your parting shot?
What I would love the people to know is that you need to have autonomy over your own health. I want people to take charge of their own health. If you meet a doctor that doesn't want to have conversations or answering your questions in a polite manner, and acknowledging when they don't have the answers, I think you need to change your doctor. Sure. And what really hurts me and is so traumatizing for me is that what seems to be, there are many good doctors out there, and there are many Christian doctors who are practicing their faith, but the current medical model, unfortunately, seems to be that to keep people as sick as possible for as long as possible for maximum profit. That's not how I operate. I want to empower you to the point where you don't need me. That actually you're so empowered to take care of your own health that I just meet you on the streets and you're telling me you're fine. That should be that should be the medical model. Yeah. From the Hippocratic Oath, never do any harm to anybody. Always know what you're prescribing. To the young doctors out there, I'm so sorry that you came and found this system the way it is, but you can learn and relearn how to practice ethical medicine. Never do any harm, always do good, give informed consent. Whenever you don't know something, admit that you don't know, do more research about it, and treat everybody fairly.
Dr. Eda, I know many people watching this podcast would really want to know where to get you. You are a resource in the community.
Yes.
People would need your counsel, your knowledge.
Yes.
Please tell us how we can get you.
Okay, yes. So as you introduced me, I'm the founder and director of Wastahili Family Wellness Center. We are in Nairobi, and you will be able to find us on the internet. And so that's where we are.
Thank you so much, Dr.
Most
Eda.
welcome.
I've learned a ton today.
I've also learned.
And I'm looking forward to many more.
Thank
you know,
you.
we do this for the community.
Yes.
And I can see many more of these conversations
I look
happening.
forward to
Thank you.
too.
Thank you so
Thank
much. My name is Mary Kathomi, the host of Hekima Hub. And this is where we are having conversations that are affecting the society. Our conversation will be spanning from health and wellness, social issues, we go to political issues, but you're more so geared towards the African community, the Black people, because that is where we are based. Please like our channel, subscribe to our YouTube channel, and let's keep having these conversations. If you'd want even to be a guest on this podcast, why don't you just drop a message on the comments, and let's have these conversations. Let's build up more and more and more.